Jotine Olympic BlueRx is a great reckoning. Inflation in the food supply is at issue. So who wants a great reckoning to save money, improve local management, customer satisfaction, improve customer loyalty? Barcode data at the grocery store with a fee schedule is the atonement for these grocers. They'll help explain the CPI to consumers. Checkout volume data by hour of day is a sacrament, a communing with the righteous grocers. The employer rosters have not been confirmed for development for economic mobility in the old Jotine Olympic tradition. That's a huge opportunity. Pharmacy data by product description, where loss prevention is a specialty. It's a sacrament called Stegology, from the same word as stegosaurus, to cover, to conceal, to protect. We need that data managed by people that know how to deter, the diversion of opioids. And data on the coupon program. We know that a BlueRx system helps improve the strategy of the grocery store from the coupon program, which clearly isn't working based on CPI. So here's to a great reckoning of Jotine Olympic BlueRx. More Leo, more Alpha, less LV, less mischief, less red lettering, less pharmaceutical, more grocery, foods that heals us, ability first medicine. That's what Jotine Olympic is about. It's part of the Lincoln Blue New Deal. More good policy, the unification of quality and finance, or is, my Lincoln Blue New Deal, it's sitting before, one or more of the state legislature, and less clowning around. More stoic, less neurotic, more appraising, less Barber law from the, Dutch West India Company. People don't understand that one of the reasons that, our republic doesn't function as well as it used to is that after the Civil War, the Dutch West India Company roared back by kicking non-Dutch people out of the practice of law, and something that today is known as the Bar Association. And so we're striking back against Barber law, with something better. We're striking back against Dutch West India Company accounting. These are the things that are behind, the consumer price index issues. Is we're saddled with the costs of Barber law, of Barber accounting from the Dutch West India Company, where people are standing there in line waiting with their carts, for the, machine Gestapo, for the, self-checkout Gestapo, where there are carts and carts and carts so long you can see the curvature of the earth. Carts, with patriotic Americans that are willing to scan their own groceries. If they can scan their own groceries at the end of the line, waiting at the Lycan end of, the earth, they can scan as they are shopping, real time, so that there's no line. We don't need to wait in line for machines. We don't need to wait in line for the Dutch West India Company's accounting system. We don't need to wait in line for the Dutch West India Company's, loss prevention systems. For Barber law, piracy law. The machines need to work for us. And every one of us has a more sophisticated machine than that grocery scanner in our pocket. Jotine Olympic BlueRx comes from the rider, the knight, the hero. It's a corporate pharmacy program. It's Stegology, to cover, to conceal. Like I said, from the same word as stegosaurus, to prevent diversion. Ragnar Rock Alpha is a European proven technology, constructive technology. It's a white label brand with a mission for mankind to overcome, to courageously defeat the challenges that hamper us. Coronavirus, opioid abuse, disease, parasites, and these issues of CPI. Barber law, Barber accounting. Our exciting rebellious story of Jotine Olympic BlueRx is a chivalric order of faiths that mark the upward trend of mankind and America in building A-frame houses here in the continent that'll inspire win for your grocery, for your pharmacy, for your brand, for your career, for local ownership. This oathing by lay people is a tradition of JAG-FEDIC tradition, a Jotine Olympic tradition, as grocery management are on the front lines of this heroic battle of ability first Hippocrates. Hippocrates meaning, the Hippocratic Oath, for unlocking the full potential and are lacking the sacraments, the sacrament of your rostering, the sacrament of those worthy of confirmation, in the old economic mobility tradition of Jotine Olympic, which was, having pages, having squires, Jotine Olympic pages, Jotine Olympic squires, ordination of knights. Louis Pasteur, Charles Napoleon Bonaparte, was a incredibly significant figure who was king of the French, in eradicating disease with pasteurization. It's right front and center in this CPI issue. That was work between his lab and the grocery store. It wasn't at a healthcare facility. There's medicine, there's good medical science to be done in our food supply. The self-scanning direction is an old tradition that has come and gone, where the tragedy of the green keeps those areas from the cleanliness standards, the depreciation of user errors that cause checkout machines to depreciate faster. And, mostly I want to convince you that Jotine Olympic BlueRx can do better. It's a proven technology you can put into the hands and the palm of your customers. For the grocer, it's a benefit that the phone depreciates rather than your scanners. The scan's completed real time by people. Having humans make decisions is better than deferring to machines. The obsession with technology, it hasn't made us healthier, it hasn't made us live longer, it hasn't made us better as a people. It also hasn't made our local grocers better managed. America has won more Nobel Prize in physiology than the next 8 countries combined, but that science is not percolated into grocery stores, and that's newsflash, we haven't cured an illness since Louis Pasteur, with a small number of exceptions, like Jonas Salk. And see, that's so important because we're dominating the world in Nobel Prize in physiology, but we can't get safe food at the local grocery store. We can't get affordable food down at the local grocery store. It's basic. And so, having high science come down from that ivory tower, and do the good work, the pasteurization style new science that needs to be done to make our grocery stores function and be healthy for us again. And that's the product pricing promotion. You don't need non-skilled, non-healthcare MBAs making those decisions. You don't need barber attorneys making those decisions. You don't need barber accountants making those decisions. That's the whole problem. Is those are non-skilled individuals that have a certification from the Dutch West India Company. And so, we're looking for angel investors, donors, participating grocers, consumers to join this movement, to join the Jotine Olympic BlueRx movement. And, for grocers, we know that grocers are the key beneficiary because you increase your reach, you increase and broaden the engagement of your shoppers. You're able to dramatically save on costs. There's very little that saves on costs more than moving to the Jotine Olympic BlueRx program. And so our data request for you grocers is having a flat file of vendors, including the expense of the last 12 months, a flat file of barcode data with the fee schedule, and any participating discounts and the channels that those are going through, a flat file of checkout volume by hour, by day, a flat file of your employee roster, a flat file of pharmacy data by product description, and we're looking for descriptions of the product, and we want to group them, which we'd like to work with your pharmacy team on to do away with the opioid epidemic in America, because we know that the opioid epidemic has a small number of choke points, and pharmacy is one of those places where we can absolutely win. We ask you join us in this great reckoning, Jotine Olympic BlueRx.